Hi, I'm Dr. Griffin, and the purpose of this video is to go over the steroids section in the dental assistant packet. So there are 4 questions in your packet. One is, when would we prescribe steroids? Steroids are used to reduce inflammation. The other type of medication that we use is antibiotics. Most of the disease processes that we deal with have both inflammation and infection that are working inside the tooth to cause the disease. Sometimes there's more inflammation and sometimes there's more infection. Your doctor will try to identify which part of the disease process is most active. Is it inflammation? And if it is, we're going to prescribe a steroid. If it's infection, then we're going to prescribe an antibiotic. So to answer the question, when would we prescribe steroids? It's when there is an inflammation inside the tooth, in the pulp, or when there's inflammation on the outside of the tooth in the periapical tissues. The second question is, what are the 2 prescriptions, steroids, that we use and how often are they written? So one thing you want to know about prescriptions is that they're only as good as the compliance of the patient. So you can write a really lengthy and really detailed prescription, but if the patient doesn't take it, then it's not effective. And that seems really common sense, but it's true. One steroid that we really love to use is called Medrol Dose Pack. And it's a 5-day course of steroids. It starts with 6 pills and it comes in a blister pack, and the patient just pushes the pill out of the blister pack, and it's very simple. It says on day 1, punch this, take this pill, this pill, and this pill, and this pill, and there's 6 of them. And then the next day they take 5 pills, and the next day they take 4, and the next day they take 3, and they just keep going until it's gone. That's what we call a Medrol Dose Pack. It's very easy for your doctor to prescribe, and it's easy for the patient to get, and it's easy for the pharmacy to fill. So Medrol Dose Pack. The second prescription steroid that we prescribe is prednisone. Now prednisone doesn't come in a dose pack. It's basically 20 milligrams taken twice per day. For 5 days. So those are the 2 prescriptions that we use for steroids, and we prefer the Medrol Dose Pack because it's easy. The third question is, how is a Medrol Dose Pack packaged and taken by the patient? And I already kind of explained that. It's a 5-day course of steroids. You take 6 in the first day. Even if they get it in the evening, they need to take all 6 pills that first day. And then it tapers, and it's -1 pill for each additional day. So 6 pills, then the next day it's 5, the next day it's 4, 3, so on, till it's gone. The next question is, what potential side effects do you need to discuss with the patients? With all medications, there are contraindications, which are reasons why you wouldn't prescribe a drug. There are 2 kinds of contraindications. There's relative contraindications and absolute contraindications. Absolute contraindications are basically reasons why you absolutely would never prescribe a drug to a patient. It's kind of a black and white thing. For example, nitrous. You don't give nitrous to somebody that's pregnant in their first trimester. It will cause birth defects. That's an absolute contraindication. You don't do it. Then there's relative contraindications. Relative contraindications are basically things that would give you pause to prescribe a drug. With steroids, we'll call it an absolute contraindication. You still could, but one reason why you don't want to prescribe a steroid is it could spike somebody's blood sugar, and that would be bad in diabetics. So we don't prescribe steroids to diabetics, and that's the big one, and that's the one you really want to remember. Long-term use of steroids can cause mood alterations, nightmares, and depression, even suicidal thoughts. But that's typically happens for long-term use of steroids, like 30 or 60 days. We don't do that. We don't prescribe that long of use of steroids. So we really just have to watch out for not prescribing to diabetics because it can spike their blood sugar. So that's basically sums up steroids in a nutshell. Sometimes patients will have a nightmare or have a mood alterations, but typically not. In 5 days, it's such a short course of steroid that they typically don't have any of those smaller side effects. So I hope this helps. Again, this is the steroid tutorial for your dental assistant packet, and I'm Dr. Griffin. Thanks for watching.